This is your Barbados Today Evening News Update for Thursday, October 7th. The Barbados Light and Power is making a bid to hike electricity rates. The company said today it had applied to the Fair Trading Commission for a review of the current rates. BLMP says a significant rise in costs and necessary investments, including its new 33-megawatt clean bridge energy plant in Trent St. Lucie, has forced the company to make the move in what it acknowledges is a tough time given the high cost of living. It says the proposed increases should be no more than $6 for low-income customers using less than 150 kilowatts in a month. With the typical bill increase, with the proposed rates is estimated to range from 5% to 20%, depending on the tariff of which customers receive their service. The company pointed out that its last rate increase was 11 years ago, and this was only the second time it was seeking a rate increase. BLMP says the increase is needed to maintain a safe and reliable energy service. In other news this Thursday, daily infections from the coronavirus continue to soar, and Acting Chief Medical Officer Dr. Anton Best today warned the current situation remains dire. He expressed concern that more than 2,000 active cases and pointed out that the island had recorded a 500% increase in cases since August.
We are in a dire situation right now. Over the last few weeks, we've had a very high incidence or rate of cases of COVID. And if you would permit me, I just want to put some perspective on it. If you look at the rate of cases in August, or the total number of cases in August of this year, we had 689 cases. In September, we had 3,500 cases of COVID detected. That's a 500% increase in the number of cases. And so far for October, we've had over 1,000 cases. So we've already surpassed the total tally for the month of August. I think it was in the dashboard from 2 days ago that we reported we had 318 cases. And this is 318 cases in a one-day period, which was significantly higher than the 207 daily case average up until that point.
Barbados moved past the 10,000 mark as it recorded 259 new coronavirus infections. 129 males and 130 females were confirmed as testing positive from the 2,165 tests conducted by the Barbados Santos Public Health Laboratory on Wednesday. The new positives consist of 65 persons under the age of 18 and 194 people who are 18 years and over. There are 647 people in isolation facilities and 1,491 in home isolation. A 75-year-old man passed away from COVID-19 on Wednesday at the Blackman and Gollop isolation facility. He had pre-existing medical conditions and was unvaccinated. Overall, Barbados has recorded 10,082 confirmed cases of COVID-19 since March 2020. 86 people have died from the viral illness. Under the national vaccination program, just about 40.5% of the total population, or 48.1% of the eligible population, are fully vaccinated. The continuing spike in cases is overwhelming isolation facilities. Mere days after the official rollout of government's home isolation and quarantine program, Consultant Manager of Home Quarantine Dr. Adana Grandison reported high numbers at today's news conference.
As of right now, because we are running a live dashboard, we have 1,486 persons in community, of which we have made at least first contact with 1,186 of those persons. And this is a live dashboard, so it also incorporates persons who have been essentially tested up as close as to yesterday. So we're trying to get all of our persons who have at least not had that first contact for a healthcare provider to initiate contact with them, with the first step being notification. This process really starts from the point of swabbing, whether the person has presented to a polyclinic or to, for instance, the gymnasium, or even to a private healthcare provider or mobile testing center. This process begins with swabbing.
Meanwhile, a special hotline is being set up in the coming days to assist COVID-19 patients who have been complaining about a lack of timely response from health authorities.
So we have multiple hotlines on the island where if persons are starting or their status has changed, they're feeling unwell now, they can reach out. Because this is a very new program, we are actually developing a call center specifically for persons who are in home isolation. This is going to be an internal number. So essentially, if you're in the program, we want to give you this number, and that will be available for persons within home isolation within the next few days. And this is because we don't want persons, I know a lot of persons may say, well, I call a hotline number and I'm like number 25 and something is really, really wrong. If it is an emergency, we ask you to call our emergency numbers that we have for general emergency on the island, which is 511 in case you are, because everyone thinks 911, but in a panic, it's really 511. However, during this period of time, until the next few days when that number becomes live, essentially you can call the hotline, or you can even call your polyclinic doctor if you're within the catchment area, or your private doctor.
In other developments, Barbadians should brace for heavy rains and possible thunderstorms this weekend. According to the Barbados Meteorological Service, the expected adverse conditions will be generated by a combined trough system and tropical wave. Acting Senior Meteorologist Raquel Davis explains.
In the purple circle, you can see Barbados with our accumulations for the weekend. With that being said, we can expect 3 to 6 inches of rainfall across the island during this time as the trough system affects us. With that being said, excessive rainfall and severe thunderstorm watches and warnings can be issued at short notice.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To regional news now, Guyana health authorities say an autopsy conducted on a 13-year-old schoolboy who died on Monday, a few hours after receiving a second dose of the COVID-19 Pfizer vaccine, found that he died because of bleeding in his brain. More in this report from Newsroom Guyana.
A massive brain bleed and heart disease have been listed as the cause of death for the 13-year-old who collapsed and died shortly after he was administered a second dose of the Pfizer COVID-19 vaccine on Monday. The post-mortem was conducted by government pathologist Dr. Nihal Singh, who found that the teen suffered massive bleeding in his brain before he collapsed and died 2 hours after he took the vaccine. The young boy Joshua Henry complained to his parents about feeling unwell moments before he collapsed and died at home after returning from the vaccination site. The parents also reported seeing a dark color on his skin close to his joints. The Ministry of Health has launched a full investigation into the boy's death. Samples have been taken from his organs for additional scrutiny abroad. The Ministry of Health is continuing its investigation tonight. A team was dispatched to the Region 1 community of Maruka yesterday to begin the probe into the young child's death.
On the international front, Pfizer Inc. and biotech are seeking the approval of U.S. regulators to authorize emergency use of their COVID-19 vaccine for children ages 5 to 11, a group for whom no shot is currently allowed. We get more in this report from Reuters Television.
The COVID-19 vaccine for kids could be just weeks away. That's after Pfizer and BioNTech asked the U.S. Food and Drug Administration to approve emergency use of their vaccine for children aged 5 to 11. White House COVID-19 response coordinator Jeffrey Zients told CNN the vaccine for young children could be ready to roll as early as November. The FDA set a date of October 26th for its panel of outside advisors to meet and discuss the Pfizer-BioNTech application. It's possible for kids to begin receiving the vaccines shortly afterwards. Zients told CNN, "We are ready. We have the supply. We are working with states to set up convenient locations for parents and kids to get vaccinated, including pediatricians' offices and community sites. Rapid FDA approval could help mitigate a potential surge of cases this fall, with schools already open nationwide. Children currently make up about 27% of all U.S. coronavirus cases and an increasing percentage of hospitalizations, according to the American Academy of Pediatrics.
That's news, but for the very latest, you can visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Capital Media HD 99.3 FM.